So this is something that happened to me on Saturday, which I thought a perfect way to start this session. So the whole day was actually free. I had nothing scheduled that I had to go to or do. And so I thought, well, I've got to get that work-life balance talk whipped into shape here. So that's what I'll work on. And then somebody in my family came to me and said, how would you like to go for a walk? I said, no, I have to work on this talk on work-life balance. And in that moment, the irony hit me harder than I would have imagined. It's really hard. It's really hard to make decisions around the work that you really want to do and want to do well. This wasn't something I shouldn't have been doing. And spending time, personal time, family time, other kinds of time, and to somehow integrate all of those. So today what I'm going to do is we're going to talk about some kind of conceptual issues around the concept of work life at the beginning, and talk about some assessment techniques you can use if you want to. I'm trying to focus on kind of concrete strategies that you could try. There'll be a little bit that will be overlap-ish with the last session, but not much. How many people are coming here for the first time today? It'll be the first time. Okay, all right. So we'll go through them, but maybe a little bit more quickly. And if you have questions, I'll take questions from you two, but not Dr. Gusick. She's on her own for that. So we'll cover that. And through all of this, I want it to be clear that I don't think anybody has final answers for you about how to do this. So I'll just throw ideas out. You'll think about as we go along what things you might like to try, or what that triggers for you to try to make your own life more a higher quality. Really, you're going for a higher quality life maybe that you have right now. So does that sound fair enough? And there are lots of resources out there that you can find. I'm sure there are TED Talks about this. I thought about looking for some, and I thought, no, I have to go on that walk. So no TED Talks for you today. Okay, so first we're going to talk. I'm sorry. The first thing we're going to talk about is what this concept means to you, because it only has meaning to you. Not everybody is going to have a slightly different definition. So what I'd like us to think about is, what does work life mean, and what does balance mean? And what would you think of as a sort of a metric for yourself about what would look like a high quality life that encompasses all of the things that you want it to hold? Okay? Let's dismiss right off the bat this idea of true balance, where you add up how many things you have, divide by 18, and that's how you assign the number of hours that you spend on it every day. No, I don't think anybody really thinks that that's what balance means in this case. But if you do, I think nobody out there that writes about this or thinks about it for very long would think that that's true. So I thought maybe, if it's okay with you, if you are energized enough, to maybe at your tables, not talk about your own personal vision so much as kind of what you think the elements are. What would be the elements of a good work-life integration, or whatever we want to call it. Yeah, and or what metric you would use to know that you've achieved it. Either one of those or both. So do you mind, would you, at your tables, just talk about that a little bit? And we'll capture a few of the ideas on this whiteboard. I'll give you about, 5 minutes? Does that sound right? 5 or 6 minutes? Okay. Introduce yourself at your table if you don't know each other. Okay, why don't we come back to the group? I'm sure you have more things you'd like to talk about, but we could vote just to stop and spend the rest of the time, but no, probably not a good idea, huh? So what I'd like to do is go to each table and have you say one thing that's not already written down on the board, and let's just see how many ideas we can get. So why don't we start with this table over here? Just one thing that you came up with, one thought. Oh, that'd be a good idea, probably, yeah.
One of the metrics we came up with was kind of defined by other people that are important to us in our lives.
Okay. Okay, good. So how they're, yeah, okay. Good, good. These will all be good, so I won't keep saying that. What about this? Anything? If you don't have anything, that's okay. You can pass. If the table doesn't have anything they want to add, that's fine. No worries.
I don't know how to put this into one word, but we were saying balance is where we felt like we weren't cheating either side.
Oh, okay, okay. No, good. That's good. You don't have to say one word, by the way. One sentence is what I was hoping for. I like that quite a bit. So far, I like everything I've written down here. I'm just going to put part, meaning you get to fill in the blanks about what parts are important to you. What about, yeah, let's do this easily for the microphone. Did the two of you have anything?
I guess sort of similar, to not have our work elements encroaching into our life, and like being able to make sure that you got to have dinner with your family every night.
Okay. Okay. So a subset of this not cheating any part is a common situation is when work actually encroaches on personal. So that's, for a lot of people, that's the biggest thing. Not always, though. Yeah, back here.
So we kind of went a little off script.
Maybe I won't write yours down then.
Okay, fair enough. So we were talking about the idea that it's really not so much work-life balance as this idea of what energizes us and what depletes us. And that there are depleting things in both work and life. And there are things that are energizing and nourishing in both of those domains as well. And so really kind of redefining the scales.
Yeah, so that would be more of a... be more of an integrative in the sense that you're not looking at these two kinds of activities, but all activities, and then looking to see among those what, yeah, good idea. Where are we here? This table, do you have anything? Well, let's hear what you have to say.
Take your lead.
Take your, yes, so this would be a strategy. Take vacation. Absolutely. And I prefer actually to say work personal or professional and personal, because everything you do is work in some is physics sense of the things. And life makes it, if you say work life, it sounds like your work is really not part of your life. So personally, I like the professional personal mix. Okay. Okay, so the thing is, whenever you have big changes in either one, you have to reevaluate. That's really critical. Just like with your time management system and your lists and so forth, you have to change those every time you get new stuff or get rid of stuff. You've got to make sure your system works. So great. What about this table? Anything to add?
I don't know. That sounds really... I've had some surgery recently, so I think just figuring out how to be absence of physical discomfort. So working so hard that you're spending so much time trying to get rid of physical.
Could we expand that to say, I mean, for, in certain situations, that'd be the main thing, but you also don't want to have psychological discomfort, right? So a metric would be, well, no, I get, having limit, how about that, limit? I'd like to say eliminate, but physical, emotional discomfort. And that would be a subset of depleting forces, yeah?
Well, another word for that is pain. Whenever a doctor says you're going to feel some discomfort, it's usually what word you're going to feel extreme.
And so it's in the big picture, sort of writ large, is any kind of pain. Yeah, good. Do you have anything here?
I guess we kind of want, this is something similar to number two. Talk about like feeling guilty, or not doing or not, completing certain tasks, both aspects of life,
Right.
and how they can integrate it. And then as a strategy, we talk like about being present when you are doing, fully present in the sense of like, I get the example, but sometimes like if I'm with my kids, I'm checking email, I'm answering email, I'm answering some behaviors and something. And so whatever limited time that we have, we'll just be present.
Yeah. And another one that you said was to abandon guilt. Yeah, good. Anything else, anybody? And we're not trying to come up with a comprehensive definition here, or we're just trying to come up with some ideas for you to work with when you're thinking about your own, any changes that you might need to make. So let's see, what do we see here? So, what I see in this part is the thing that maybe one of you said, or somebody said, maybe it was me, I can't remember, that you want to look at all the parts of your life that you're currently focusing on and make sure that you're doing something in all of them to keep them from falling behind or damaging relationships. You want to be more positive than that, I guess. But so this is a really good, I really like that list. And these are some strategies, sort of little ones, if in a way, of taking vacation and time off if you have it. Is that hard to do here? Do people not use their vacation? We don't know the answer to that. Do you use your vacation? There we go. Okay. Oh, okay. And then this idea that every time something big changes, you have triplets, for example, that'll change your thoughts about, personal balance, or even one. You don't even need three at a time. And being present is a common strategy. We'll talk about it a little bit more. Okay, good. This is good. So this gets you thinking, I hope, a little bit about your own. So you should all think about what you'd like that to, what metrics you'd like to use, and then that gives you a way to start thinking about the strategies that you want to use to get there. So it's like any other project plan. Define what you think you want your outcome to look like, and then start working on it. So let me just point out a couple of things that I don't think are up here so much. One of the problems with talking about work, even professional, personal, is that we think of work, even though it's not, as sort of a unitary, homogeneous set of activities, and we think of the personal stuff as like an activity, when in fact that's not true at all. We have many different roles often within our personal life, so we're not trying to just juggle two things. We're trying to juggle, as in the case of this person who is a clinician and a scientist and a partner and has children and a triathlete. Any triathletes here? You could do it. What's that? There we go. And maybe have some kind of community involvement. So you're not just balancing two things. You're balancing, in this case, 6 things. Does that make sense? So you don't want to think in these big, giant categories, but to think about the individual things that you're actually wanting to be involved in. And then the other thing that, so this is a little bit, we won't be talking about a lot of data today, but this comes from a meta-analysis a few years ago where they looked at what were the causes of what's called in the literature work-family conflict. So it turns out that for a lot of people, the problem isn't work versus personal in general. The real problem is work-family conflicts. Because with family, there's more potential for, and that's loosely translated into kids and other people that you're caring for, because the potential for scheduling conflicts gets to be so high and need for time off with family as opposed to other things that you're doing. I'm supposing that's the reason it's such a big deal. But there's lots and lots of research that's been done on work-family conflict. And so from this article, the big conclusions were that both men and women have this. Sometimes there's a belief that only women have work-family conflict, but actually that's not true. who does have a bigger conflict are parents, which if any of you have children, you know that that automatically adds a level of complexity. And when you experience work-family conflict, your overall job and life satisfaction is at risk for going down in both arenas, and it's a risk factor for burnout. So that's kind of that part. And in terms of kind of some subcategories, and this is maybe a little hard, when I say both directions are associated with job stress, and family conflict, when your work encroaches on your family, it affects all of those things, your job as well as your family. And when your family is encroaching on your work, which actually happens more than you would think, it leads to the very same problems with job stress families. So either direction encroaching on the other is a problem. Now, this article was not really intended to talk about evidence-based approaches to, it wasn't focused on what helps, but it did have a little summary in the discussion. And some things here that you wouldn't be surprised about, that if you have an effective coping style that you can use when problems come up, and if you have a good level of resilience, those obviously would help, and they do. Interestingly, supportive family or supportive conflicts can help, or colleagues. So if you have both, then that's terrific. But if you have supportive colleagues, that can actually help with work-family conflict, and vice versa with a supportive family. So it's nice if you have both, but you don't have to. And then they did say something about time management, which I put a little exclamation point, because I thought, well, I know something about that. But figuring out in time how you're going to allocate your time across these different things is obviously good. So I always try to keep in mind that for a lot of people, the work-family problem is really the one that they need to focus on. I don't have a lot of good jokes for this talk. If you think of any, just shout them out. I'll try to work on that. So let's talk, now this is another sort of by way of introduction and ideas for you to think about section. Some people at least believe that the mindset you bring to these situations makes a big difference in how you experience them. And there is a little bit of, to any kind of problem or conflict that you're facing between different parts of your life. And some of these are backed up by evidence. So let me just show you some ideas here. And you can think about whether you have any of these beliefs that may be limiting your ability to have better integration or not. So this is, the first one is one we talked about to some extent this morning, which is that you may be able to do anything, but you can't do everything. So people often, in academic medicine, get caught up in this because they're curious people, they're smart people, there are a lot of things they want to read, there are a lot of things they want to do, they want to make progress in their career and so forth. So they agree to do more things that they can possibly have time to do. And then similarly in our personal lives, due to the wonders of the internet, we can actually get involved in anything we want and learn how to do it and start doing it right away. So one time, for example, I Googled how to climb Mount Everest for the first time. Now, I had actually no interest, nor would I ever have interest in doing this, but I found 2 websites that said, here's exactly what you do, step by step. And I thought, whoa, for just a split second. Or freezer cooking. Does anybody here do freezer cooking? It's the extreme version of it is that you just cook 1 weekend a month and everything is frozen. And then, so you have to shop all day Saturday, cook all day Sunday. I tried this once and I collapsed on Sunday night, so I thought, well, this is not for me. But there are, or you want to take up any quilters here? No quilters? This is the first time oh, good. I've never had an audience without a quilter in it of this size. And so you may have decided to take up quilting just at the very time you're thinking about promotion 2 years from now. And now you have this hobby that takes a whole room filled with looms, piles of material everywhere, and you know what I'm talking about here. And it's a small closet. She's not a real quilter, so far as I can tell. So we can really take on anything we want, and because we're interested and curious, we do it. So we end up with more than we can really do. Now, normally I make the audience recite aloud recite this aloud with me. Should we do it? Let's do it. I may be able to do, hey, but I can't do everything. So we have to do it twice because you did a poor job. You always do a poor job the first time, right? So it doesn't really matter. Okay, I may be able to do anything, but I can't do everything. And actually, this by itself is a problem for a lot of people who are upbeat, energetic. They just have taken on too much. And that's the problem. That's not always the problem, but that is sometimes. We'll talk a little bit about how to sort that out in a minute. So here are some mindsets for which there is some data. So there's a little study that was, and there may be more data than this. This is the only study I know about. It was a study of mid-career women who had participated early in their career in a Robert Wood Johnson career development program. And the investigators decided to go back and check in with these women several years later to find out how they were doing, how they felt about life and work satisfaction. And then they did some instruments of various things. And what they found was that there were two broad groups here. There were women who weren't doing very well academically or personally, and the group that was doing well. And the locus of control was different between these two groups. So women who believed that all of their problems were coming from outside of themselves were not doing very well. And the people who said, oh, well, there's a lot of problems out there, but I have to control what I can control, they were the group that was most satisfied overall and with work. So I don't know how easy it is to change your locus of control, but if you think that you have that one that is sort of blaming other forces for preventing you, you might think about whether you might want to reevaluate that. Did that make sense? It's kind of intuitive, but there we have some data. And the next one is the belief that your goals are compatible. So there's a study that was done in the North. It was a study of 16,000 women in the Northwest United States who worked and were married. Those were the two criteria. And they looked at a whole variety of things, but they included depressive symptoms. I don't know if they did a clinical diagnosis of depression. I can't remember. And so it's a longitudinal study. So like 6 or 8 years later, they did a baseline assessment of a variety of things, and then they did the post-assessment. And at the end of the assessment, they found that women who felt that they had to be really good mothers, because I think they all really good, like super moms, mothers, and they had to do well at work, were more likely to be depressed than women who said, oh, well, I can't do everything perfectly. I'm just going to do the best I can at home and at work. And they did better. They were doing better psychologically. They were less depressed. So there's something about thinking you have to be perfect at everything that can lead to trouble here. And I think that's what my next point is. So there we go. Now, the next mindsets are just things that are true. We don't need any data to prove them. And that is, no matter what you're trying to do, there are going to be obstacles. And people easily get discouraged by those sometimes and kind of give up on making positive changes. So just recognizing that there will always be obstacles, no matter what changes you try to make. It helps you to think about it from a problem-solving point of view or a solution point of view instead of getting drugged down by the fact that there are obstacles. And this is an interesting one, which I had never heard about before, but it turns out there's quite a bit written about this idea as well. And it stems actually from a Harvard Business Review, or a Harvard professor of business, Clayton Christensen, who 12 years ago or something like that, when he was in his 40s, wrote an article in the Harvard Business Review called The Well-Planned Life, in which he laid out as a graduation speech to the business school graduates, how he had, throughout his life, he'd seen too many students who went off to become, just dug into their business and spent 18 hours a day working to improve them, to get promoted and so forth, and left their family and friends behind. And then that didn't work out so well for them. And so he laid out a method that they should consider using instead, where they plan in advance, so sort of lay out a plan for how they're going to balance or allot time to all of these different places that are important. And it's something that he did in his own life. So that's become known as the well-planned life school of thought, which makes some sense, right? It's think life is a big project. What are our goals? How are we going to get there? What metric are we going to use for success? So not too long after that, David Brooks, who is, he's a New York Times columnist on the opinion page. Maybe you've seen stuff by him. He might be politically a little on the conservative side. I'm not sure. He wrote an article called of course I didn't put it up here because I didn't, the summoned life. The summoned life. And that's the approach that he thought was better, and what he said by that is we shouldn't make our life focused around being successfully achieving goals. Instead, we should think about our life as being an experience that we're in the moment, and we're going to do the best with what we can and make what we can of it, and we'll just more of a journey approach where you're going through life as a journey, and success is not determined by achieving goals. Now, so those are two, both of them include the ability to achieve goals, et cetera, but what I'm going to suggest is that this is a pretty goal-oriented group in this room. And you probably think about your professional life as only being successful if you get X, Y, and Z papers, grants, et cetera, et cetera, et cetera. And you may have actually goals for your kids or for your family as well that are important goals to achievement goals. And maybe it would be a good idea to back off of that a little bit and think about the experience of life, sort of day-to-day living, focusing more on relationships rather than goals. So I'm just going to suggest that you maybe get a little bit away from the success metric and more toward the journey metric. Now how would you do that exactly? I think being present, just practicing being present, explicitly not defining, I'll only be successful in my career if I get this goal met. You're a setup there because you never know how things are going to go. Doesn't mean you can't have goals, but you don't define the success of your life by these goals. Now I'm starting to sound like the Episcopal preacher from down the road who, you get the point. You can look at these and see to what extent they might be helpful to you. Okay, now this I really liked, and I really, really liked it because where I found it was in a James Patterson book. You know James Patterson, the most prolific producer of books in the history of the world, who now writes all these books with other people, so he gets even more because, and in a book I don't think I've read that book, Suzanne's Diary for Nicholas, but, so I really like this metaphor, and so I'd like you to think about this. Imagine life as a game in which you're juggling 5 balls: work, family, health, friends, and integrity. You're keeping all of them in the air, but one day you come to understand that work is a rubber ball. If you drop it, it will bounce back. The other 4 balls, family, health, friends, and integrity, are made of glass. If you drop one of these, it will be irrevocably scuffed, nicked, or even shattered. So it's a nice way to think about it, isn't it? Because it's true, I think. And if you want to keep this, if you want to think of this whole life approach, so think about that. Don't worry, I'm just not going to be reading quotes through this whole thing. Okay, now the final point I want to make is one that we all recognize, but we don't always talk about it, at least from the podium. And that is that a lot of the challenges that you face in your work as academic clinician scientists, those of you who have that job, or even working at the university with all of its various policies and procedures and organizational changes and paperwork and so on, a lot of, and the policies that the university has about when you can go and when you have to stay and so forth, are an institutional issue. The same thing is true about burnout. There was just an article in somewhere, I think the Harvard Business Review, talking about how burnout is really it's the institution's job to solve that, not individuals. These are true things. You are in an institution that has certain rules and regulations and policies that limit what you can do personally about achieving balance in certain ways that you might like to do it. And there are all kinds of things that you are faced with in your work that seem onerous and, how should we say, pain-producing and depleting, like email, EMR, IRB applications, writing grants repetitively over and over and over with not much chance. All those things are true. But there are things that you can do as a person there are workarounds you can do. There are things you can do to take control, back to that locus of control idea. So I don't want you to think that I don't know that all these things exist, because I perfectly well know they do. And you know they do, but you can't let that stop you from creating a better life. Okay, the sermon has now officially ended. I'm going to sit for a minute here, and let's see what's next. So now I want to lay out kind of a way to assess your situation, some questions you might ask yourself, some ways of thinking about if the problem is too much to do, some general ideas, some specific ideas that can help reduce stress and make you more present and balanced, some time allocation methods that we've talked about a little bit, and we'll go over those in this context. Okay, and there's lots more that you could find if you read about this or think about it or talk with friends about it. There's not one solution here. Okay, so these are the main questions. These are some questions you could ask yourself. There may be others for you. The idea here is, instead of just saying, oh, I have poor work-life balance, it's to say exactly what in my life isn't working. What pieces of my life are encroaching on others? Where are there, is it really true that I just don't have time for everything? Are there conflicts in time or effort between X and Y across all these things you do? Is this a time in your life when you really need to be focusing more on, maybe you have babies at home, and this is the time you really need to, that's a much bigger effort than it will be when they're, I don't know what age it is when they stop being work, but I think 25 is probably right. But the transportation and childcare gets easier as they get older. Or you do get everything done, but you're just exhausted emotionally and physically, with or without pain. So those are kind of where, so if you can kind of pick out what are the specific things that are bothering you. Is that, can everybody think, you don't have to say, you're not going to be asked to report these. Can anybody think of one thing in their life that meets one of these criteria or some other specific conflict that's not so generic? You might have to think about it a little while. So one specific example would be, in my current life, I have to spend 5 hours at night completing my medical documentation, at least 4 days a week. And that's conflicting with numerous things, time with my kids, my family, et cetera. That would be a specific conflict. And do you see how identifying that as the problem doesn't lead to a magical solution, but it gives you something concrete that you can start to work on, rather than just saying, oh, I'm so tired all the time. Try to think about what things seem to be at least partially underneath that. Now, I can't tell whether this concept of a specific assessment is making sense or not. You could blink your eyes twice if it is. What do you think? Well, let's keep going. And unless anyone was willing to throw out another example besides the EMR that they can think of. Or my life would be perfect if our department didn't have meetings at 7 a.m. 2 days a week, and I can't take my kids to childcare until 8 o'clock. So that would be an example of a work-family conflict. Yeah? And once you've identified that as a specific problem, now you can start thinking about, is there something I could do at the department level? Is there something I could do on the getting my kids to preschool level? Who should I talk to? Can I get can I get an excuse for not going to all the meetings? There are lots of things that you could start. It'll start to generate more concrete ideas about what to do. That would be a good example. Okay? All right. Now, we've already talked about how children are a special case. There's more trouble with children here than, or a bigger challenge for, all reasons you can all think of. So we won't say more about that. Now, I want to also say, because in this area we're starting to edge into areas of mental health issues and burnout and so forth. If you think you're in a situation that is really serious, you are exhausted all the time, emotionally or physically. You are feeling either depressed or anxiety symptoms that are interfering. I know you know all these things, but you don't always think to go see somebody about them. You really have to seek some kind of more professional help, because self-help strategies are not going to get you out of that. So don't hesitate to seek help if you need it. Okay, so let's talk about if you think you have too much to do. Probably everybody here thinks, I think that's probably a pretty generic one, so it's a good one to start with. Okay, so let's talk a little bit about how you could try to right-size your current workload, which means reduce. It doesn't necessarily mean you got that. So the first thing that you could do, no, there are two kind of assessment strategies. Assess how you're spending your time, and assess what you're actually doing that needs time. Do you see that those are two different things? So first, I just want to pitch the idea of using time tracking as a tool. Not necessarily or something that you would do every day. I'm not suggesting that you would necessarily, some people do it every day, but I'm not suggesting that you do that. I'm thinking about doing it in an assessment mode where you do it for a while, maybe a week, just 1 week. And you keep track of everything that you do on a time grid so that you can see how much time you're spending. And I do not encourage you, so the purpose of that would be to see whether what you say to yourself about, I don't have enough time to sleep, I don't have enough time for any personal time, I'm spending too much time at work, if those things are really true. It turns out that people reliably misremember or don't actually have a good idea of how they spend their time unless they write it down. And this is true across a whole range of activities. I used to do PMS work, and it became clear to early investigators that most women who said, many women who said, about half of the women who said, my symptoms only occur in the late luteal phase, premenstrually. Half of them were wrong about that when you asked them to actually keep track of their symptoms. The symptoms were actually happening all the time, but there was an attributional bias, so they believed that stuck with them, that it was occurring at that time. So that's just one simple example of how people don't really remember things very well. And there's another person who studies this, a journalist who studies this, and there's an institute that does it. And they have both come out with data suggesting that people who say they only get a few hours of sleep, actually, now this may not be true in this room, I understand that. You're probably more attuned to it. Actually, most people do get enough sleep. They just report that they're not getting it because they don't actually keep track, and they feel tired, so they say, I'm not getting enough sleep. Now, I don't know, or I don't have time to do anything personal. And then when you keep track of your time, you see that you watched Chopped for 3 hours last night. And so I could choose to watch Chopped, or I could say, maybe just 2 episodes of Chopped would be enough. And for one of those hours, I could do something else. Or maybe the episode I've seen 3 times or more. I could skip that one. So you might think about time. Now, one way to track your time, the woman who is sort of the modern disciple of this in the popular culture is Laura Vanderkam. You're going to get her full name in a book that she wrote that writes in another slide. She's the journalist who's interested in all this. She's been tracking her time for 12 years, every day in an Excel spreadsheet. And she has 5 children now. She's had her 6th child. Oh my God, she keeps having children. And she's a freelance. She travels all the time, and her husband travels all the time, and they balance all these kids. And it's very interesting, but it's the time tracking that actually helps her get all that done, because she can see where to make changes. So her method is to take a grid that's in 30-minute, I think these are in 15-minute increments, but you could do 30. And in each box, you just write down the main thing you were doing, like email, laundry, clinic, and then block out the time you were in clinic. So you don't have to give a lot of detail here. And then you write down when you got up and when you go to bed. And you'll be amazed, actually, at some of the things that you see. So you might try that for a week and just see, and then you can use that, for example, to say, well, these are my highest priorities. How much time did I spend this week on any of them? And, highlight the ones where you did, and you may find out that most weeks you actually don't spend much time on the very highest priorities that you have. And that'll be a message to you that something needs to change if you want to keep those as priorities. And on her website, if you go to her website, there's actually a grid that you can download, and she has some instructions that you might want to follow. You can really do it however you want, but I think a week of this is a pretty valuable technique. Has anybody ever done this? What do you think about this idea? I have firmly resisted it my entire life until I finally was convinced to try it. And I do it in special situations where for one day I want to see, I use it most often on days when I have not much to do. I have a big gap in time. Those are the days I tend to waste the most. So I use it, and it helps me, I use it more proactively as a tool. So if I have a whole free day, and at the end of the day I've only worked on the first sentence of the abstract that I started with in the morning, that's a problem. So I do a thing where I track my time, and if I wrote down abstract for 8 straight hours, it would be embarrassing. So it forces me to move on. So I use it as a tool to use my time better. It's another thing that you can do with time tracking. And when you do that, you can just do it intermittently. You don't have to do it every day. But I would really encourage you, to see whether what you firmly believe is true about how you spend your time, if it's really true. So think about it. Just 1 week. Just 1 week. All right. Not seeing a lot of enthusiasm. Read Laura's book and you'll know. Okay, now the second one is trying to assess what you're actually doing. And this falls prey to the fact that most people don't actually keep track in writing of what they're doing. So you have to, if you're going to really do this, you have to start that way. So there are 2 ways you can do this activity assessment. The first way is the one that takes the most time. Not a lot of time, but takes more time. And you may be at risk if you do this for fainting or nausea or lightheadedness because you didn't realize of all the things that you actually are doing. And so you have to be a little careful about it. I'm actually not kidding about that. I have people tell me that all the time. So this full inventory of work eventually can be a really helpful thing where you write down you list all your roles. So the roles would be the things we saw on that slide back there. So one would be you're a clinician, you're the assistant program director. Do you get what I mean? You're whatever your research role is. At home, maybe you are caring for elderly parents. That would be a role. You have kids. That would be a role. Maybe you're the only one that cooks. That would be a role that you have. So just think of all the roles that occupy a lot of your time. Make a list of those. And then for each of them, just write down what your regular responsibilities are. Like for how many hours do you spend, or what are your responsibilities? Just routine things for being the assistant program director. What do I have to do for that on a regular basis? And you can do that for all your roles. And then you can also think of what special, project work you're doing. The kind of clear things that you're working toward that are not going to be ongoing, but are going to be done, like writing a paper or a grant or a white paper or a curriculum revision or a report to the dean or whatever it is that's a project kind of thing. At home, it would be regular responsibilities for cooking would be shopping, cooking, cleaning up, cleaning the refrigerator out periodically, and the pantry. No, the pantry and the refrigerator would be project work, because that's just done occasionally. It's kind of a big deal. So you can make a complete list of all this. And that could be very enlightening to you if you haven't ever done that. Now, the quicker way to do it, which we can actually do right this minute, if you have something you can write on, whether it can be done on a computer or a phone or whatever, is to do the quick start method, which I kind of like actually as a beginning thing anyway. What you're going to do is going to give just a rapid, intuitive response to 2 questions. So the first question is, so we're going to do it right now. Are you ready? What would you like to do more of in your life or start doing that you're not doing right now? The rule here is that you're not thinking about whether you can actually do it or not. You're not thinking about whether it's feasible. You're thinking about what would you like to be doing more of. Does that make sense? So no limits on this. I've never met anyone who couldn't come up with one thing, but some people are, they're doing what they want to be doing. They're just not, maybe spending their time the way they'd like to. Did everybody think of something? How many people wrote exercise? Haha. So that would be one that would, a lot of people have that one because it's hard to work in. So you keep that list. And then now, what would you like to do less of? And here again, it does not have to be realistic. What would you like to do less of? Or potentially stop. I'm not going to allow you to say stop all email, because that would be so unrealistic. Now, this list can go on and on and on. These would be all the pain points that you have that leave you depleted and that seem not that important to you. Does everybody have something written down in this category? Okay. So what you can do with this, you might want to redo it at a time when you have a little bit more time. But even this small sample is enough to help you kind of tune into the things, the really important things that you'd like to make priorities to change. So if you want to do it over again later with a little bit more time, that's fine, or just use what you have to get started. And this allows you to focus in on those things right away without doing that full inventory. Because intuitively you know what things you would really like not to be doing. You don't need to know that it's 45th out of the list of 145. So the strategies about when you want to do less, we could go on and on about these, but I just want to give you the concepts here because you can figure some of this yourself out, or there are books out there to help you do that. You only have two options when you want to do less of something. You could either do it differently so that it takes up less time, or you could stop, don't do it. Can you think of another option here? I can't think of one. You can't manufacture time, so this is it. Stop or do it differently. Now, the do it differently category is really the whole realm of kind of traditional time management. Be more efficient, reduce the scope, lower your standards so that you're not aiming for perfection. So be more efficient. We'll go with the cooking. Too much cooking. To be more efficient, you could do things like use a pressure cooker, which would allow you to make things faster, some things faster. I'm kind of a pressure cooker fanatic, so if you'd like to talk about that later. Well, I convinced one guy to buy a pressure cooker. I just talked to him a few weeks ago. He said, yes, after your last talk, I went out and bought a pressure cooker. So I said, excellent. So you can get Instant Pots now and other electronic versions of pressure cookers, which of course is not what I have because they didn't exist when I bought my pressure cookers. But so everybody can be a pressure cooker person now. Or you could use a slow cooker, would do the same thing, right? It'd be more efficient because you wouldn't have to be involved in the cooking process as much. So reducing the scope would be serving simple meals 3 times a week and more elaborate ones 4 times a week. So cutting down on if you're a real cook, you really want to make fancy meals more times than you have time for. So you could just cut back on that and say, we're going to do simple stuff during the week and I'll do fancy stuff on the weekends. That'd be an idea for that. And lowering your standards would be, if you really, one example of lowering your standards would be, we're going to have frozen meals 4 times a week, which you can do. You can buy perfectly decent frozen food that you would serve to your family 4 times a week. And that would be lowering your standards, potentially. If that's not what you normally do. And so that would have the advantage of reducing the amount of this you do. So those are 3 ways that you could do that. And so what you want to do with anything that you want to do less of is think about what you could do in each of these categories. It's important to recognize that even a little change can make a big difference. So I was on a plane a few years ago with a woman sitting next to me. I don't normally talk on the plane, but somehow we got to talking. And she turned out to be a retired ICU nurse who, in her retirement, had taken on the role of working with NGOs around the world, who are working in humanitarian disaster areas, like the original tsunami, Haiti, and so on and so forth. So she jetted all over the place, helping. I don't know exactly what she did, but that's how she spent a lot of her time. And so we got to talking about time management a little bit. And first, she wanted me to advise her about the new handbag that she should get. And I said, I'm really not an expert on that, but I'll see what I can find out. And then she went, oh, I have to tell you the thing that made the biggest difference for me in the last couple of years. I thought, I'm kind of excited about this. So it turns out her husband was still working in a job where he had, his requirement for himself was to have a fresh, starched white shirt to wear to work every day. And this woman had been ironing his shirts for years, along with other ironing. She did all the ironing, and these shirts were just too much. And one day it occurred to her she could take them to a laundry. And she said, getting rid of ironing those shirts has made such a huge difference in my life. Now think about it. Here she is going all over the country, spending a lot of time out doing these things, and getting rid of this one task which she detested, in her words, changed her life. So don't give up if there's what seems like a small thing that you really would like to get rid of or do less of. Go ahead and do it anyway, because it can really help change your attitude and free up a lot of psychic energy that you've been wasting on that. Now, to not do it, there are 3 options. Stop doing it, delegate it, or outsource it, and do it later. So on the stop side, the first thing I'd suggest that you do is look to see if there's any low-hanging fruit about things you might get rid of. Activities you've been doing for a long time. Maybe you've been on a committee for several years, and you believe that you have contributed to that committee sufficiently, and then you realize someone else could have the opportunity to be on that committee and learn something. So maybe it's time for you to resign from that committee or that activity that you've been on for a long time. Now, I used to do this periodically. I'd say, what am I doing? What have I been doing for a really long time? Even though I like it, it's time for me to get off of it and free up some time. Typically, what I always had the response from people, I can't believe you stayed on it that long. Good for you. Now, I don't know, it's not always possible to do this. Maybe your chair wants you to be on the committee, or I'm not saying you have to get off of committees, but it could be that there's some things that do you agree with that?
Oh, when I started, I always tell junior faculty when they sign up for a committee. My advice to junior faculty when they're asked to get on a committee is first figure out what it's going to do for you. And by that I mean, what will you learn? Who will you meet? Those kind of things, how it will contribute to your career. And second of all, when you agree to be on it, ask for a term. Certainly no more than 3 years, ideally about 2. And then at the end of that term, you might be reappointed or you might gracefully exit. But yeah, absolutely. Those committees. I was on some committees for 10 years. Yeah. And by the end, you're not fresh. You're not bringing new ideas. You're really tired of it. And so you're not doing anybody any favors.
So I don't know if you have things like that you're dealing with right now, but there may be other activities that you've been doing for a long time at home that maybe you don't really want to do. That you could free up time and not lose a lot of pleasure. Go through your to-do lists and get rid of things that have been on there for a long time that you clearly don't seem to be too interested in doing, and just prune some things that have been kind of aspirational more than anything else. And just take them off or move them into that other idea list so that they're not on your list, and see if you don't feel more energetic getting rid of things that you're not really committed to doing. And then there are things you dislike that you should try really hard to stop doing. So I was appointed, I loved being on committees, and I was on lots of them, but toward the middle of my career, I got put on the the laser safety subcommittee. This was because I used a laser to treat cervical disease, warts and dysplasia. And so they thought they needed a clinician on the committee. So here I was in this small room with 6 engineers and me. And it became pretty clear I didn't have much to offer to that committee. And I resigned within, I think, 4 months, which was an all-time record for me. So anything you dislike. And then time wasters, the 8th version, the 3rd episode of Chopped you've watched already. There are things you're probably doing kind of out of habit, or they're stress relievers, but they're not really adding anything to your life. I mean, if you're watching something that really relaxes you and helps you feel better, that's fine. But sometimes we just kind of fall into activities, especially at home, that we could divert that time to something that we feel better about doing. So that's where the time tracking can really help quite a bit. Did you have something you wanted to add to that?
I can't tell you how many times we watched the entire Office. it's on a loop at our house.
Oh,
We tell
yeah.
ourselves it's because the dog likes it.
Now, here's an example of a time waster.
It's a great show, but, you know, I think there is certain, I mean, as I look at that list, I think, I have lowered my standards so much
That's right.
at home, because work takes so much energy out of it.
Yep.
And
Yep.
there is some of that.
So Donald, do you have anything you do that you shouldn't be doing? Well, that was too broad a question, I think.
I think just going through useless emails and actually reading something.
Oh, yeah, so you can overdo it on the email, where you're reading things you really,
You know, I've gotten much better about getting off listservs and
Yeah.
and blocking things just because it's serves.
yeah. And I had a problem like that, where I felt like every email that came to me that was about time management, every blog, I had to read it. And pretty soon I realized there were certain categories that were just useless for me to read. And so I have drastically reduced the amount of time I spend reading blogs. I read the ones that will be helpful to you, but not the ones that, you know, that were really didn't have any real role in my vision about what I was doing in this area. Oh, goodness. Is it time for us to stop? What did I do?
You punch the button and the button
Oh, so you got to see the whole thing.
We've seen it twice.
All right, so you should be good. Okay, so stopping we've talked about. Now, this is another list of things that we may have mentioned some of these that are, I think, are really big problems for people. I would include myself in that group. These are things that are come out of your mind that tend to dominate your thinking and have generally negative impacts. So the first one, which something I call dream work, is work things that you have thought of that you would like to do in your career, but really this isn't the time to do them, or you're not sure. So that you're trying to work on current stuff, and instead this, but I could be writing a grant on this, and then you spend time thinking about it. So that dream work can overcome your ability to focus on your real work. So what you want to do there is put that in write it down someplace and set it aside, and don't think about it in that way. Scope creep is a big one. So I was once assigned to revise a little, 2 pages in a American College of OB-GYN guide to something. And I wasn't even going to be the author. I was just going to be the reviser of the one that the first person wrote, which is a painful process, let me tell you, so don't ever agree to do that. But I said to myself, I thought about it a little bit, and then I thought, I'm going to make this the best 2 pages on this topic in the history of obstetrics and gynecology. Well, that was a stupid thing to think, because that wasn't the point. All I had to do was get the references updated, make sure there were no inaccuracies, and add if there was anything new that had been come along. So I do that all the time. Scope creep is a big problem for me, where I'm set to do something that someone's asked me to do, and eventually the project just grows and grows and grows in a way that it doesn't have to. It would be perfectly fine to stop here where I'm supposed to be. Instead, I want to make it bigger. So pay attention to whether you are prone to scope creep on anything. Housekeeping, writing, I don't care what it is. There's a lot been written recently out of the psychology literature about the effect that having regrets and ruminating about them can have on your emotional health. And I'm not one to, I can't, that's not my area of expertise to help you stop ruminating, but I do have a couple of references that maybe I'll add into this slide where you can go read some ideas about how to do this. But these can be really damaging, because it's one of those things you're worrying about something that you can't change for the most part. And the ruminating just takes your mind off of any positive energy that you might have. And then I suppose along those same lines, these last 2 kind of fit with the above topics. If you have a goal that actually doesn't work for you anymore, you should rethink that goal and either modify it to meet what the real goal, what your better goal would be, or get rid of it. So we sometimes get the idea as we're going through our early career that the only way to make progress is to pick a goal and stick with it no matter what. And perseverance is what will get you, make you successful. But that's not really the way it works. You pick a goal so that you have direction, and you start out, and then as you go and work and do things, you discover how to refine that goal or maybe even change the direction of it. That's not failure. That's doing things in a sensible way that will lead to more career satisfaction and success. And then you want to also, of course, eliminate any, if you have to modify your goal, if you decide to, the feeling that you failed is not a very useful way to think about it. So all of these things can dominate your thinking in a way that really detracts from your ability to enjoy your current life and move forward. Now, outsourcing and delegating. This is a hard one. This is a really, first of all, my guess is that many people in the room don't have a lot of opportunities to delegate at work unless you have a staff that you can delegate things to. And outsourcing is an excellent idea, but it does cost money, and so that's not always practical. I'm thinking of things about like house, personal life related things. The snow, you don't have snow removal here, do you? You wait for the sun, is what I heard. So in Iowa, we have snow removal. Yard maintenance, shopping, you could have somebody do your grocery shopping for you. The grocery store will do it and deliver it. So what do you think about in particular this concept of having somebody else do something that has heretofore been your responsibility? Does anybody here have any, I mean, there are obstacles for people as they think about this, but does anybody in this room want to throw out something something about giving work away that's a problem, makes it hard to do? Yeah.
Well, I try to practice, I think give work away. I mean, I had 3 kids in career, and I'll have young physicians particularly will say, well, how was that, how did you work that out? And one of the first things I said, I had a great housekeeper twice a week for many, when the kids were younger, and that was just.
Did she do laundry and things like that, or?
She did some laundry, I did some, but she was wonderful. I mean, she was the kind of person who would put, the stuffed animals on their beds, just really cute and everything. And, that was incredibly vital to just, be able to do it. Yeah.
So I think the housekeeping thing is the thing that a lot of people have trouble with. As opposed to having somebody rake your lawn or, things that seem more okay to do. So does anybody, I don't really want to ask how many people actually have somebody occasionally come to clean their house. I mean, I will say I do. Yeah, how many? Okay, I'll ask. Okay, so it looks like this is not a problem for most of you. Good, I'm glad to hear. Because I've heard a lot of, especially early career women say, I just couldn't do that. It costs money, and they wouldn't meet my standards. Lower your standards. Okay, yeah.
I would say a professional one. If you have any amount of administrative help, if you have even 5% of an administrative person's time, use every second of that. And have, even though it can take time to train somebody to do a small task, but, I'm thinking of something I'm doing now with 87 applicants for a job. That is a lot of CVs and cover letters to look at. But just by getting my assistant to print out the cover letters, saves me some time, lets me do it kind of in various places. But, usually I would do that myself. And I think finding, even if you have a small amount of time, what can they do? That's 5% of your time. Exactly.
So I will just say that on one of the articles I wrote on the website is about delegation, and it goes into more detail about how to think about that so that you'll become enthusiastic about it. I think sometimes it's hard when you've never worked with an assistant before and you only have a small amount of somebody's time to know what you should do with that. So I always think that it's reasonable either to talk to somebody more senior who uses that person, or talk directly to the person and say, what are the things that you do that that I could ask you to do, if the person is someone that you think you could ask that of, because that's their job. I mean, that's what they're there to do. And I know some assistants get really annoyed when someone walks over to the copy machine. Now, that's not everybody. I don't want to say that that's true, but try to find out what assistance you could get if it's not obvious. Anything else about this topic? Okay. The reception isn't till 4, but we can have a little break before that if Okay, and then the later thing is the idea of sequencing things, and the idea of having a place where you can record stuff that you're not going to do it now. You're going to give up quilting for the time being and come back to it a year later, for example, or you're not going to take it up right now. You're going to wait. You can do this both with professional project work or new roles or things in your personal life that you think you'd be interested in. So you can just have a place where you record all that stuff, or you can put things on your calendar that you want to bring back into your life at a particular time. I think we talked about this in the first session this afternoon a little bit. But keeping track of those things is important because otherwise they'll just bug you if you're not doing them. Now, what if you want to add something? Now, what I mean by that, what if you want to add something that you would really like to do? So I'm talking about like maybe one thing that you are just passionate about. You would really like to start doing more exercise. You really would, or you would really like to take up a hobby, or you would really like to do more writing of some kind. There's something you would really like to figure out how to do more of. There are two ways that you can go about this. One of them is to do some time tracking, some allocation, and look at all the things you do, cut some things out, and create some time to start doing that thing. That rarely works because it's hard to do all those things. And your better bet would just be to say, I'm going to start doing this now no matter what. I'm going to start doing it maybe at a really small level. I'm going to experiment with different ways to do it so I can start fitting it in. Now, I can't say I was enthusiastic about exercising, but I knew I needed to do it. So what I did is I signed up for a trainer, twice-a-week trainer, and there it was on my calendar. I was paying money for it. I had to go. And so that's how I got started doing that. I just decided, even though I don't feel like I have time, I'm going to do it anyway. And there is something about adding something like that into your life which creates the time it needs, because other things aren't so important to you, and you'll start to figure out how to do less of them or do them more efficiently. So this is Laura Vanderkam, the woman I was telling you about, who, the book that I'd recommend, she's written several books. The one book I would recommend that you look at is I Know How She Does It, How Successful Women Make the Most of Their Time. It's a study she did of 100 women who were defined as successful by making more than $100,000 a year and had children at home. She had to just have a definition. There are several physicians in the sample. And she had them do time logs for a week, and then she analyzed the time logs and discovered the ways in which these women managed to get more done than most people do. It works for men, too. It's not, she just happened to study women. I think that's her primary audience, probably. But the techniques that she came up with are important ones. And at the beginning of that book, she has what I think is an idea that really supports what I just said. You don't build the life you want by saving time. You build the life you want by doing the things that you want to be doing, and then time saves itself. Recognizing that's what makes success possible. So the people that you know who get a lot of writing done despite being active clinicians, they really want to write. They really want to write. And so they figure out, I'm not saying that if you don't really want to write if you're not doing that, but typically they will just say, this is important enough to me that I'm going to figure out how to do it no matter what. You can only do that with about one thing at a time. But I just want you to keep that dynamic in mind so that you're not putting off doing something important to you just because it doesn't seem that there's enough time. Okay, you need to choose your new work more carefully, and you gave an example of that, Sue, when you said with the committee to ask yourself, is this something that's going to be valuable to me? Am I going to be able to make a contribution? Will I meet people that I wouldn't otherwise meet and have to expand my network in the institution? These are the 6 categories that I usually personally think about when something new comes up. I'm asked to do something new or think about something. The first question is this part of my job? Now, that would seem like a no-brainer. But for me, I often have things that I'm supposed to do I'm putting off. And then one day I realize, you know what? This is part of my job. I'm being paid to do this, so I'd better get on the stick and do it. So ask yourself if what you're being asked to do is part of your job. Now, you might, if you have a boss that you can negotiate with, you might be able to negotiate some things away by trading or doing something else. But if it's part of your job, then you sort of are going to be doing that. The second one is this something that I have already promised somebody that I would do? Now, this is more about work that you've already added in rather than new stuff, but it relates to new stuff in that I think a useful way to think about promises that you've made is that those are moral contracts with other people. And if you break the promise by being late or not doing it at all, you have breached, your integrity is breached, and eventually other people's trust in you will go down. And I've seen people whose academic careers have been damaged by failure to follow through on things they promised. I'm not sure none of you do that, but it can happen. And so this dynamic should help you to think carefully about promising a big thing to somebody before you've decided that you can do it. So don't just promise to do something unless you've thought through the likelihood that you can actually follow through on what you've said you will do. Because then you have a great response to the ask. You can say, you know, this does sound interesting, but I cannot, I don't have the capacity right now to be able to do that job the way it needs to be done. And that's the answer. It doesn't work for everything, it doesn't work with everybody, but that's a way to think about those things. These are two tricky ones. What you're thinking about doing or taking on is related to an important goal that you have. Here the problem is not that you agree to do it, but that you agree to do too many of these things at one time. So you end up with a whole batch of things, and you can't really devote appropriate time to any of them. So you have to think about staging, making sure you're not overcommitting, so that you actually get the value out of the things you are doing, and maybe putting some things off for later if you can do that. Now, the interesting, fun, and satisfying things you might say would be an easy cut, but hopefully in this session we understand that that's not a good idea, that you do need to keep things like, it's important to keep things like that in your life. So again, just not too many to fill up more time than they can occupy. And then the final two are ones that maybe I'm the only person who's ever run into these. Well, the first one, I'm sure not. So have you ever been like in a division meeting or a group, and where the leader of the group says, we need somebody to cover clinic next Wednesday morning for somebody who's out, and there's silence. And pretty soon in you wells up this feeling, oh, I should. Nobody's going to do it. I'm just sure of it. It has to be done. Have you ever known anybody that has that feeling? And so if you're somebody who has that happen to you a lot, you need to kind of reevaluate that feeling and be careful about just jumping in just because you're having the feeling. It may be somebody else's time to volunteer. There'll be another arrangement made. In the end, you may end up doing it, but at least not by just giving in so easily. I'm all for volunteering, believe me, but you can't be always the one that volunteers. So think that through. And then the final one, this may be only me. This is the I'm the only one. So you're called, this happened to, I remember the first time, big time, the memorable time when this happened. Somebody called me, an editor of something, and would I edit a monograph on X, Y, or Z? And it was a topic that was not quite on point for me. And he said, oh, this is such an important monograph, and oh, it'll enhance your reputation, blah, blah, blah. And I felt another feeling coming up in me where I was swelling up with ego. I have to do this because I'm the only one. He said so. I was probably the 14th person he'd called. So whenever you feel that feeling of ego that says do it, do it, do it, you really have to be careful about that. Because it is so easy to get off course and pick something that is not for you, and you'll regret every minute of it. So I would always take those. I would never agree to something like that right away. I would say, thank you very much. I may have some other questions, and then I'll get back to you for those, and then I'll let you know within a reasonable time frame. Has anybody else in the room ever had that happen to them? It's a terrible thing when you realize what you've done to yourself.
I had that happen yesterday.
Oh, here we go.
I got an email from someone that I taught a couple of sessions for their organization in the last couple of years, and then they moved to a new organization. They want me to teach 2 sessions on the 13th and 14th of June. I get back from France at 7 o'clock at night on the 13th. I almost said, well, I'll do the 8:15 one on Sunday.
There we go.
Like, serious? You're not going to do that.
Yeah, so that's
but
a
I was feeling like, oh, she wants me.
She wants me. She wants me. She likes me. Yeah. So absolutely. So it can happen with little things, but it's a mistake to do it because you're not really committed. You'll be in pain when you're doing it. Okay. And then of course that leads to the no question, which is a huge question. A lot of people, some people easily say no. Sometimes they say it too often. But sometimes when it's time to say no, they don't have any problem doing it. And other people have a really hard time saying no. I would say I probably fall more, I used to always fall into that category. I'm better at it now. But it's still always kind of hard for me to do because I'm thinking about the other person and the other thing. So we could have a whole seminar on this, but we're not. You'll be happy to know. We're not going to go through all these right now, but these are some ideas that I think are pretty common ideas about how to approach a situation where you have decided that this thing you're being asked to do does not fit in any way with your time frame, your interests. You don't have anything to contribute, much to contribute. All those different reasons, you've made a solid decision that this isn't for you. It'll pull you away from working on your own goals because it's so time consuming. I think the one that I want to point out here is for some people is a really key thing. Some people just have that internal feeling that they're responsible and that it's selfish to say no. It's selfish to say no. So, of course, the comeback to that, which you just have to let soak in, is if you're always saying yes to other people, you're by fault just saying no to your own goals. If you always say yes to other people, then you're saying no to spending that time on your own goals. And it isn't that those other things aren't sometimes important, but you don't want to go overboard. And I love this last one, which a friend of mine who's a vice provost said. This was his approach. He said, I just say I'm not available. This would be for like events. So it would be like your talks after your friend. I'm just not available. And he said, in my head, the end of the sentence is to do that. So this leads to the point that for people that you don't need to maintain an ongoing relationship with, you don't have to tell them why you're saying no. You just say, don't have the capacity to do that, but thank you very much. So don't get caught up in thinking you have to satisfy people that really, in the long run, aren't that important to you. Anybody want to have anything? Yeah.
As a person that seems to have to ask people to do things for them frequently.
Yeah.
These last two slides made me think of there's two things. If you overpromise yourself and you don't do them, and the person has to be on your case all the time, you're not doing yourself any favors by promising to do something and not doing it well or not doing it
On time.
Yeah. And things, so that can really backfire and something to keep in mind. And the other thing is for saying no, there are people that seem like they always say no, and that doesn't really sit well with your colleagues. So I think you should be really careful about what you say yes to and what you say no to.
I absolutely agree with that. It's a mistake. I mean, sometimes you'll read advice that you should say no unless you can think of a really good reason to do. I mean, that you have to have you should say no to everything your first couple of years. I just think that's a mistake. I think you have to be careful about it, make sure that the things there's going to be value for you in some way, whether it's meeting people, learning a new skill, getting involved in a project that you might be interested in pursuing yourself someday, getting just experience in the institution and being known. There are lots of good reasons to say yes, but you don't want to overdo it. I personally.
Well, I was thinking about, so we have this mentoring pilot this year that is folks who just came last summer. We have a cohort of about 20 people, and one of the things we've learned doing a couple of meetings with the folks and having open-ended conversations with mentors and mentees separated is how important that first year of employment is for exploring. And so if you look at our website, you'll see the factory life cycle, and there's exploration phase. And it's really been really interesting to sit with the new faculty and hear what that means to them. But it really is about getting to know people. And so I met with a new faculty member a few days ago with her mentor, and that mentor talked about the mentor's experience with mentees who do that well, who go to coffee with a lot of people, have lunch with a lot of people, go to people's lab meetings, watch people teach, about how important it is to really do that exploration, and maybe a very time-limited part-time on a committee or something may be part of that exploration, But do, as back to what I said earlier, think about what you were going to learn from being part of that, and consider it a really critical part of your early career to explore without deep commitments, but really about learning and contributing what you have to contribute as a new member of the faculty.
Yeah, so this is, as you can see, kind of a hard one. And it's important, I think, if you're getting asked to do something you're not sure about, is to consult with, if you have a mentor or a senior person, that you can find out whether, what they think about how valuable this will be for you. So you don't say no when maybe you should be saying yes, and so forth. Okay, let's see. Okay, so these are just some isolated ideas that I think are helpful. The first one, that code O is a method when you feel acutely overwhelmed. And that's the feeling when you look around you and you just can't think what to do because you feel so overwhelmed by everything you have to do, you're just paralyzed. Now, if this is your constant state, that's a bigger problem, but it happens to everybody every once in a while. So my suggestions are in line with what other people recommend. The emergency treatment is to get back in the moment and stop thinking about the outside and just get back right in your current space. So you want to stop and take a deep breath. These will make sense to you. You want to slow down instead of speed up. Usually people start to act frantically, and that's a big mistake. So you want to just slow down and make a quick list of everything that seems to be on your mind that you're being overwhelmed with. Just take a few minutes and just jot down whatever comes to mind that feels overwhelming. And then pick any task that you have to do, no matter how tiny, and do it. So that all of those things bring you down into the present moment. And if you do, and then you might need to do another task and then another one, and pretty soon you'll calm down and you'll be able to figure out what bigger thing you might want to work on. So having a method to use when that happens so you don't flail around all day, I think is a good idea. One of the first article in my thing is the Code O article, so it's written out in a little bit more detail. This is the idea of getting everything out of your head into the list, so we're going to skip it. How many people? So one of the big ideas that's it's not a fad, but a commonly written about time management technique now is journaling. Journaling is very big. And we're not, so does anybody here have any kind of journaling practice, just out of curiosity? Okay. So there are lots of different kinds of journaling methods that you can use, but one that I think can be really helpful because it's confined to first thing in the day, sometime early in the day, and then you don't think about it anymore. It's called morning notes. Are you familiar with that concept? So you are, is that right? So morning notes is a term that was invented by Julia Cameron, who's an artist, I think, and writer, in her book, The Artist's Way. Thank you so much. Back in the 80s? It's a pretty old book. Yeah. So the method this is a method that she describes in this book that she uses every day to increase her creativity. And you can actually expand this to do more than creativity. So you sit down with, she would say, a notebook or a piece of paper, and you would set a timer for, say, 10 or 12 or 15 minutes, and you would just write whatever comes to mind about anything that comes up. And then when the timer goes off, you're done. You can do it with a typewriter. I do it on a laptop. I know there may be some advantages to handwriting, but I can't read mine, so they would be useless at that point. And what I find, the kinds of things that pop up for me when I'm doing that writing are things that I had forgotten about that really need to be done, somehow are in my subconscious pop up. I think of solutions to problems that I've been working on. I have idea flashes about things I might write about, and sometimes that'll take me into making a little plan for something that I've been thinking about for a long time. It's amazing what you come up with, and you just feel kind of settled going into the day. You can do other kinds of journaling at other kinds of day. Two other commonly written about options are to do a daily debrief at the end of the day. So at the end of the day, saying what went well today. This is the one that, tell us about the notebook you use, the debriefing. Don't you, no, you don't want to talk about it? Didn't you tell me about the notebook you're using right now? The planning notebook? No, I think it was Michael. Oh, Michael did. Oh, I'm so sorry. So It doesn't really matter. I apologize. I thought it was you. So at the end of the day, before you go home, or at the end of the day before you go to bed at night, you just write down what went well today, and what could I improve on. It can be 2 sentences. You could do a gratitude journal, which is a really great idea, because again, there's some evidence that paying attention during the day to good things that happen that you're grateful for can change your view of how the day is going. So you might just have a notebook, and when something happens you're grateful for, you just write it down in the time and stick it in your pocket. That could include things like a patient says to you, you know, what you did for me was really helpful. And we tend to kind of overlook those things and just move on. But if you write that down, you'll realize that's a good thing, that you can be grateful that you were able to help that patient, or something unexpected good happens, and make a note of it. That can be something that can improve your outlook on life and keep you on a more positive bent. And then there are other kinds of journals that you can go online and just read about benefits of journaling and find different methods. And then this is one that the idea came from a paper that Susan Pollard wrote. But as I understand it, this was a conclusion from a literature review. You didn't, did you have data?
No, this was from, so this is interesting because the folks in this room are familiar with, you know, we've been involved with the WNC Faculty Forward Survey for many, many years. This was data from the from the Faculty Forward Survey, and what we did is we knew that there was the outcome that survey really looks at is attrition. How many folks leave institutions? Right. And so the outcome this study was looking at was, were there predictors of whether people were going to leave their position or not? And we thought that what we would find is, looking at clinical efforts specifically, there was going to be a point, some tipping point on the amount of time people spend in their clinical effort, because it was focused on clinical faculty, that led them to say, I'm leaving my institution. And so we did this analysis looking at, we had time spent in clinical effort by decile, and at 10%, 20%, 30%, for the same percent of the respondents said they were going to leave their position. Yeah. But we also asked everybody how they felt about the amount of time they spent in each of the mission areas. So in research, clinical, education, administrative. And it was the people who said they were spending either too much time or too little in those mission areas who were most likely to leave. So if you only felt you were out of balance in one mission area, you know, maybe 5% they were leaving. But by the time you got to folks saying that they were, four of the mission areas were out, all of them were out of a line, you know, a third or more were planning to leave their job in the next 1 to 2 years. So the point being, really, one of the conclusions was, when you do the annual review, if you're a supervisor, talking to your supervisee about how you're spending time, are there things you'd like to do more or less of? Even if you can't change it right away, having that conversation and moving towards spending your time differently may be protective. And Tate Chanavelt, who's done been the lead in all the work around burnout, who was at Mayo, now is at Stanford, they did a study that really looked at what is it the amount of time that that is protected,
where the 20%
and it's 20% of your time doing the thing you love the most is protective of burnout.
So remember, that's 1 day a week, and so if you think of 1 day a week can mitigate 4 days of things that maybe you're not so enthusiastic about, it's actually maybe a fairly small change that you need to make to make some difference. Now, you know what, I'm just going to go through this really fast. This is the weekly planning method that I talked about in the last session, but just to make sure you get the idea. So to do this, you would make a grid of the week, and then first you would X out all of the time that's committed to do things with other people, meetings, clinic, et cetera. You could just print out a copy of your Outlook calendar, and that might be sufficient to cover for that. Then what you do is you gray out time that you spend in activities of daily living, which is not the official definition, but eating, commuting, cooking dinner at night, the things that you do every day that don't normally make it onto a calendar. Block out all that time. And what that does is tell you then how much discretionary time you have to do everything else, how much time is not scheduled or planned. And then the next thing I'd suggest that you do is, instead of going right to work and stuff, is to plan in the personal, family, social time. Make some plans for how you might do things in that area this week. And then the rest of the time is what's available for you to do your work. And so there are 3 options that we have here to reduce stress level and improve your outlook here. One is what we talked about in the first session was about setting boundaries about when you're going to work during the week. So that red line means I'm going to work here during the week. I'm going to work during normal work hours, and I'm going to work that night. And I don't plan to work any other time. I'm going to tell my family this is when I'm working, and I'm not going to work, because it's not working at home that's stressful. It's when it seeps into your personal life that it's a problem. So that's one idea. A second one is, let me see if nope, okay. Oh, here we go. I pressed the button too soon, darn it. Okay, so, and in that work boundary business, an important one is if you're somebody that tends to linger at night at the office, none of you may do that, but if you do, you find yourself there too late, try setting a time to go home, at least to begin with, 1 day a week. And just say, no matter what, I'm going to go home at that time, barring an actual emergency. Because people tend to linger around thinking that they're getting work done, but at a certain point, there's no marginal benefit to spending further time. And you'd be better off going home, taking some time off, and coming back with renewed vigor the next day. So start with 1 day and see if you can do that. And then the other one is a concept that's been studied, again, by a professor at Harvard Business School, Lisa Perlow, about a concept that she calls planned time off. So she did a study with a bunch of consulting teams, and the study was that each member of the team got to pick one weeknight, Monday through Friday, when they would be done at 5:30, and then they were not allowed to do anything related to work until the next morning at 8 o'clock. No phone calls, no email, no nothing. They were forbidden from doing anything. They had to tell their families in advance that this was going to be their time so that they could plan things. And it was really hard to get people to do it. They had to figure out all kinds of things about coverage and so forth. But the essence of this was when people did this regularly, it improved the quality of their work and their life outside of work, all across the board, because they had that time to themselves and others during that one night a week. So you might think about whether there's some way in most weeks you could pick one night when you don't plan to do any work. You may already do that, but if you're not doing that, I'd advise you to think about it. And remember that it includes email, no checking email. Okay. Now this part will just take a couple minutes. This is pretty basic stuff, but just as a reminder about energy, which is one of the important elements of so I like this grid that lays out 4 different quadrants. It's based on energy and emotions, negative emotions, positive ones, high energy, low. So that's the quadrant. And the labels that this guy gave to these grids were, this is when you're performing at your peak. This is time when you have high positive emotions but low energy. You recover, you do recovery activities. And then this is when you are stuck in a high energy but negative emotion. You're kind of tired, but you have to keep going because what you're doing is so important. It's survival mode. You've all been in survival mode when you're on call or when something goes way longer clinically than you think it's going to. So that's survival mode. And when you start persistently having negative emotions and low energy, that's when you have to be concerned that burnout might be on the way. So that's a kind of a nice way to think about where you fit on this grid most days. Kind of pay attention. You could journal every day how much did you spend on the two elements of the performing side? How much time did you spend recovering? So you probably by now know kind of the warning signs of burnout: constant fatigue, loss of interest, detachment from patients, cynicism about whether what you're doing is meaningful, impatience. So those are kind of the symptoms that lead to burnout, which you can't help with self-help methods. You have to get professional help for that. So what you're trying to do here is, so the ideal model here would be that you spend most of your time in these 2 quadrants. You're performing, then you recover. You're performing. This is how high elite athletes work, right? They perform, practice, and then they take time off to recover because they know if they don't recover, they can't perform at a high level. So that's that. And recognize that in your job, you're going to occasionally be in survival mode, but you can't be there all the time. So if that's happening, you need to figure it out so that you don't end up in this last quadrant. I think the importance of sleep by now is perfectly clear. What I wanted to show you here is just a little bit of, this is a hand-drawn summary of the literature from an article that I read about all the studies that have been done. Do you like it? So here we have the entire week, 168 hours. And here we have a measure of productivity for whatever it is you do. It turns out that in most professions, when you get up into the 60 to 70 hours per week, you're kind of at the apex of the amount of productivity you get per unit of time. And after that, it declines. The marginal benefit of spending more time goes down. And that's the reason why you have to sleep and take time off, is so you can get revved back up again. So this idea that working 90 hours a week is actually good for you over the long run is probably not true, unless the work is something that energizes you, and that's how your life is organized, and you're happy with that. But just hanging around and working because you feel like you've got stuff to do is not. It's better to take time off and sleep, and then come back. And I think. Okay, well, this is our last slide. So can you tell this was hand-drawn also? Did you know? Could you tell right away? So here is one of those Zen stories. So we have a Zen monk who's walking through the woods, doing walking meditation. And all of a sudden a tiger appears behind him. And so the tiger starts chasing him. So the monk sensibly starts running instead of walking, and then comes to the edge of a cliff, below which, 50 feet below, is a raging river with rocks. So the only thing that monk can think of, he does strength training too in his off time. He hangs over the cliff with his arm there, and now he's got the tiger coming at him at one end, and the raging river. He'll be dashed to death on the rocks if he falls. All of a sudden, he looks underneath the cliff and sees a strawberry plant with a single red, ripe strawberry. He smiles. He reaches out with his one hand, takes the strawberry and eats it. And in that moment, he's happy. He's satisfied with life. Now, we don't know what's going to happen to this monk. It doesn't look very good, though, does it? But it doesn't actually look very good for any of us in the long run. Right? We all have to deal with living in a moment-to-moment situation and focusing on what is happening right now that makes our life good. So we don't have tigers and raging rivers. What we have are, we have things that we regret that are causing guilt and rumination, and we have the work that's yet in front of us, the raging river that may dash us on the rocks. But all we can really do is focus in this minute and do what needs to be done at that time. So thank you very much. I know this is a long time that you stuck in here today. I appreciate that. Do write to me if you have questions about anything that I've talked about today that you've heard about. I'll send you references, more resources, and so on. So thank you.